It's time to have the RealConvo, a show that brings hope and awareness to those affected by suicide and mental health. As someone who is affected by both, American Foundation for Suicide Prevention Southeast Florida board member Alan Mednick breaks the stigma with his mission that no one ever feels alone. With the help of influential guests in the community, the RealConvo starts now.
Welcome, everybody. It's Al Mednick from RealConvo. Again, board member with the American Foundation for Suicide Prevention, Southeast Florida. And we had a little bit of a hiatus. Obviously, there's something going on right now, which, is kind of prohibiting us from getting into the studio. And that's kind of what we want to talk about today. So today's going to be a little bit of a different show. I have basically a roundtable of some experts on with us to try and bring hope to a time that's kind of putting some people down now. But we want to send a message out there that even though it's social distancing, it's only physical, it's not mental. And so I want to introduce some of our guests right now. We have Evan Jarschauer, who is a professional interventionist. And I believe you're also a social worker too, right?
Licensed mental health counselor, psychotherapist.
A psychotherapist, I apologize. There you go.
Okay.
We also have, welcome to the show, we also have Mark Astor, who has been on the show a couple times. He's drug and alcohol attorneys. And we also have him. He also has his own podcast, The Journey. So welcome, Mark.
Yeah, you know what? My guests aren't as good as yours, although I occasionally do steal one.
And we'll just segue right into that. And we also have Miranda Khan, who is a former anchor and also turned into a author right now, a children's author. So welcome to the show.
Woman right here, and I love you both equally.
There you go. And also we have Patrice Schroeder, who is from 211, which is obviously right now a really important resource for everybody out there. So welcome, Patrice.
I'm glad to be here.
Well, thank you so much. So, Patrice, maybe we should just start with you. How have you seen what's going on, with 211? How has the calls been increasing? What kind of calls have you been seeing?
Well, I think we've basically doubled our call volume and some days tripled our call volume. Now, one of the interesting things that we also answer the National Disaster Distress Helpline that is promoted through the National Suicide Prevention Lifeline. So we are getting calls from all around the country of people that are having emotional crises and are in distress from what's happening. The calls that we're taking, along with the emotional calls, obviously people are concerned about their finances. I'd say that's probably one of the number one calls that we're getting right now. As we're getting close to the first, which is right around the corner, people are concerned about evictions. They're concerned about paying their bills. There are lots of food resources available, but in general, it's that financial piece. How are they going to make it? How are they going to float through this?
So you're seeing more actual people that are concerned about the finances than actually catching the disease, the virus, and worried about.
It's all encompassing, but the financial piece is great because now they're at home. They may not have a worry about catching the virus because they're now at home, either laid off or the hospitality workers. My daughter herself works at a little family restaurant in the heart of Palm Beach, West Palm Beach. So, they've all had to convert to go, which lessens the hours of employees. But they're the lucky ones because they at least have capability of serving the community. But those other restaurants and hospitality industries like massage therapists, beauticians, etc., they're done. Basically, they're independent contractors. Unless they have a nest egg, if they have a nest egg, they are struggling. So I don't know if the number was like 60% of the economy is generally somebody that's a lower paid worker, or those independent contractors are really having a tough time because they don't have the benefits.
That's interesting. So Evan, let's get your take on this. Obviously, I would have thought that, and from what I see out there, a lot of people are worried about getting the virus, worried about getting out there. What are your takes on that as far as the financial end goes compared to just the hysteria that's going on with people just worried about catching it?
Yeah, I mean, I'm working with a lot of families across the country still, a lot more remotely now, using my new Zoom format platform that I just recently got here. But for sure, there's a lot of anxiety and concern with being able to make your monthly nut, pay your rent, survive, feed your family. There's no question. And I'm definitely seeing more families, even families that do have resources, concerned about the long-term effects of how this is all going to come together.
That's a good point. So the uncertainty about when you're going to be able to get back and what's going on.
Yeah, absolutely. And for me as an interventionist and licensed psychotherapist, a lot of families where the wife or the husband would have a lot of business trips or would be working late at the office, they're not working late at the office anymore, and there are no more business trips. So the families are starting to see more and more what's really been going on. So I'm busy as well. I'm getting more calls as well. It's a little bit more challenging to get to those families, especially in the Northeast right now. But I think that families that had not seen how bad the drinking was, or the drug use was, or the compulsive behaviors were. For example, I just got back from a case where it was a sex addiction, and they finally were able to see it all because there was no more work. There was no working late, and it was pretty, he was out of control.
Yeah. So Mark, I know you're an attorney, but you do interventions basically too, try to help people get to facilities. How's this working with your business?
Yeah, so obviously we're coming at it from a little bit of a different perspective than Evan, and we've actually had the pleasure of working with Evan on a bunch of cases, and he's really terrific at what he does.
Thank you.
We're sort of coming at it from the legal perspective. So we're a law firm, and we take calls from folks all over the country whose loved ones have substance use and mental illness and eating disorders. And I have to tell you, as a sort of small business owner, I was a little bit worried once this thing really started to pick up some speed, if I was going to be able to pay my monthly nut. But actually what has happened is it's actually, I think, has accelerated things. I hate to say it, but people are really in crisis, and it's people who were maybe a little fragile to begin with, or the stress of all of this, the finances, the emotional component, is putting people over the edge. I mean, I've had a number of calls on cases where somebody got Baker Acted, which, for those that don't know, is Florida's involuntary commitment statute for mental health. So people are, suicide and things of that nature. So police are getting called to scenes, and someone's threatening to hurt themselves, or they're overdosing on pills or whatever they're using to take. And we're seeing a lot of that. And I don't think it's going to slow down. I mean, I appreciate the business, and I love helping people, but there are a lot of people out there who are really stressing out. And it's frightening, to be quite honest with you. It's frightening. I mean, it is. I mean,
So I could appreciate what you're saying, Mark. And one of the things I want to get to, and Miranda, I'm going to bring you in, and Evan, and anybody, obviously Patrice, chime in on this. We've seen situations in the past where we've had crisis, whether it was 9/11, where it shut everything down, like it shut everything down now. We didn't know when we were going to get back to work. I like to compare this a lot to AIDS. It was back in the early 80s, everybody thought that if you just sneezed or you just coughed on somebody, you were going to catch AIDS if someone else had AIDS. It wasn't until we started really getting out there. Now, this is a little bit different because we know that, if you touch something, then you can catch it pretty quickly. But just the pandemic, just the scaring behind it. Now, Miranda, I think you were, at one of the times you were probably reporting at the time.
I was
at
actually
one of these.
yeah.
So
I actually covered 9/11. I wasn't in New York at the time, but I did cover 9/11, and yeah, I remember people actually breaking down. My executive producer was from New York, and just literally broke down. I mean, and understandably so. We all were frightened, but I'm glad that you bring that up, because one of the things that I've been trying to tell people, and Alan and you and I have spoken about this, this country is resilient. We should look at those times where we didn't think, how are we going to go back to living a normal life? I mean, just the recession wasn't that long ago. We're talking 2007, 2008. I told you earlier today, I mean, I remember just seeing these foreclosure signs all up and down my neighborhood, almost in tears. People were laying people off. And look, we rebounded. We need to remind people we are resilient. We've been through plagues, we've been through wars, we've been through terrorist attacks, we've been through sickness, as you mentioned, HIV, and look where we are. the sun will set again.
And it will shine again.
Yeah.
So again, I'm sorry, go ahead.
I think, yeah, it's great that we want to build resiliency, but I think there's also the very real fact that there is no going back to normal. When we see, we're almost heading into hurricane season. That's the next story. Everything is kind of, we're to learn how to grow through trauma, to learn how to be flexible, to find the joy in every aspect as much as possible in life, the simple things, and to realize, and I mean, this is whether you're a veteran coming back to the family, the dynamics are never going to be the same, or whether you're somebody that just had a baby, Governor DeSantis and his beautiful new baby
Yes.
and child and family. There is no going back to normal. What is normal? It's always a flux, and teaching people to not be afraid, because the fear, it weakens the immune system. It sets you up for all kinds of things. But just to put one foot in front of the other, to realize, hey, we might be into new chartered waters, but yet to take in the simple things every day, the people that you love, your support systems, to just not buy into all the fear and panic. And yes, like she was saying, we too will get through this, but not to be afraid of things that may have to change, because we need to change things in society sometimes.
Right.
So that's what I love. That's what I love about, again, there's nothing good that is happening right now with people getting sick and people dying. But human nature actually just coming together in these crisis times, and we acting as one person, one human being. It doesn't matter race, creed, color, political party, everything. Everybody's coming together and trying to fight this. What is it about these times that we could take as a positive, Evan? How can we...
Yeah, so, very similar when I'm working with a family in crisis. It's amazing the power of love and family, how when we have one member of the family that's in crisis and everyone comes together, it almost always benefits the entire dynamic. In other words, for example, like in these times, just like saying that there's no question that there's going to be more suffering and there's going to be more pain and more challenging times ahead. However, it's also pretty clear that these times are bringing us together even more. For example, us right now here on the podcast, taking our time, contributing the best we can. And I think these are the types of things that we're going to see more and more of, that will bring us together, because we are a resilient people. And at the end of the day, keeping our heads together, there's a school of thought, and there's a very famous, psychoanalyst, Viktor Frankl, and he was a survivor of the Holocaust. And one of the things that he noted was that somehow, some way, he made it out of the camps. And he wrote about the fact that the thing that helped him survive was having hope.
Yep.
Hope. I just got chills myself. That he could unite with his family, but knowing that he probably wouldn't with that hope, and that kept him through. So what you have is that right now, if we can somehow keep our heads together, keep that hope that, the sun will come out tomorrow and things are going to get better. It doesn't mean that the problem's just going to go away, but it does mean that when it does get better, we'll be stronger as a country, as a family, as individuals. So I'm on board with exactly where Patrice was going with.
Yeah, I take the approach of, in war, when we go into war, and that's what this actually is, but when you go into a physical battle, there are things that have come out of, there have been creations that have come that really helped humanity and really helped us grow. I think probably the computers and everything else came from the military, and the reason why we could sit here today and do everything we're doing right now. So I try to take the positive out of this, trying to see how we can get help. And the first step is for everybody else to try and get help, to have a positive outlook on this. Patrice, you guys have a lot of resources out there. What are the main resources that you're seeing that are helping people?
Well, I mean, obviously people are concerned, like you were mentioning earlier, there is some concern about the testing for coronavirus. We're seeing people asking about that. We are, again, it's the food, it's the seniors that may be not able to do the shopping. So we've had seniors that have had their concerns. I had one personally email me through the 211 disaster email. Actually, I have a couple of things. I had a family that was concerned about visiting relatives, and one of the relatives had just come from New York. So I just gave the CDC guidelines, if somebody's been traveling from a hot spot. But I've had, seniors concerned about their next meal. I have so much now, but what's going to happen next, and I'm not able to get out, that kind of thing. So we're seeing kind of the gamut. And we do have a collection of resources. But I, too, was speaking to some college students through one of the technologies of video, virtual interview, and just trying to show the bright side as well. Sometimes Mother Nature gives us a timeout. And this is kind of like a Mother Nature timeout where you can actually take this time to get introspective. Now, granted, we're talking a lot about people that now all of their vices are popping out, and all of their, OCD and all these things are being exacerbated. But it's also time for people to reflect, to think about really what they want to. Hey, I'm getting a message that the meeting no longer has a time limit. Okay, sorry, but
nobody likes our meeting.
Decide what they want. They can decide what they want to do. They can decide maybe in the future they want to do X, Y, or Z, or they can clean their house now. You got a lot of people that are just out of the nature of being stuck. And the symbolism of not only cleaning the house, but cleaning your house, your mental, emotional state, getting in tune with yourself. So I think there are some silver linings out of this. Now, of course, the being confined together can work two different ways. You can be, like we're seeing, the marital stress of people that normally could travel or be here and had a lot of time to themselves. Now they're stuck with their spouse or mate or family. And that is they have to allow each other the time to be with themselves. But I think just finding the humor in some of the things, like I was talking to the students and saying, when I hear Corona, I think of My Sharona, so I'm hearing my Corona song, but just building our immunity, looking at our healthy habits, now's the time to maybe get into the smoothies and to fast a little bit and to just think of what your goal is physically, building your immune system.
And one of the things that I think about, Patrice, also is that because of technology, this doesn't slow a lot of people down. I mean, Mark, you're working, you're able to do it on a computer, you're able to do it on phones. It actually sometimes enhances some people's business, and people that can't work during these times, that maybe do construction, maybe they could come up with a career path that they could do on the side. Maybe they've always had a dream that they could do something, maybe write a book, Miranda, maybe do whatever, that you could have it from home, create a blog. There's so many things that you could do these days from home. This gives people the time to do it. Mark,
exactly.
What are your thoughts?
I think people have started to do things. I mean, I'll give you an example. I actually washed my own car for the first time last week in probably 15 years. I actually went outside with a bucket and sponge and washed my own car. I'm used to running it through the car wash. I'd gotten really lazy. And I'm like, I used to enjoy this. It was something that used to, mentally relax me.
Wasn't it a Zen experience, washing your car?
It was a Zen experience. Of course, it was so hot outside, and I'm about 15 years older than I was the last time I did it. I had to go and take a nap afterwards, but that's a whole other story. So, and the other thing is, because I enjoy going to the gym in the morning. It's just sort of something that wakes me up. I bought some equipment for the home, and I'm reading people online. They're starting people who maybe even didn't go to the gym and now starting to exercise at home because, they have nothing else to do right now. So they're starting to work on themselves. So I think from that perspective, people are starting to do other things that maybe they didn't do before, maybe they didn't have time for. And so, there is an opportunity to start to work on yourself a little bit. So,
and I'm seeing more and more people walking, and more people walking their dogs more. So not only
I've noticed that too where I live.
The dogs are going to be much happier.
I'm telling you, people are walking around.
So I want to get to Miranda on this, and then Evan. Miranda, obviously on Facebook, we saw your challenges that you're doing. I don't know too many people that could do pull-ups on your door. I mean, I know I'll rip it down.
I saw that.
But
I was thinking of doing that, but I was like, I'm going to rip the door off the inside.
Well, the key is you got to put a book underneath it. But, I actually went online to learn how to do that. One of the things, I'm certainly not like Evan or Patrice here, and I'm not a medical expert when it comes to mental illness, but I am an expert and have lots of experience with tragedy, family loss, job loss, divorce, yada, 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 you name it. And I've had it all happen right at once. So I've had to rediscover things about myself. You mentioned, people are doing things now that they've never done before. Had I not lost my job many years ago, I wouldn't have been able to do all these things. And one of the things I posted on social media was like, I did this. I started doing modeling. I started doing acting. I started learning how to do this. Maybe we can learn martial arts, like become a Mark Astor there.
I'm afraid of you, Miranda, just so you know that, so I would not be invited to class.
100 miles a minute, and our job is our identity. We rarely get this time, and we should look at it like an opportunity to take these 30 days, let's hope it's no more than that, but let's just take it day by day and make a to-do list of some of the things you've always wanted to do. I never would have thought in a million years I would publish a children's book. It was something that came out of something tragic, but I turned it into something positive. And I think people need to do that. Learn a recipe, learn a new workout, try something you've always wanted to do and never had the time to do it. I think that's what people need to be doing now.
Yeah, so Evan, on that stance, again, I just started working out with my son. We've been riding our bicycles.
I saw the video.
And, it's great. I get to spend time with my son, go out and do things. And I got to tell you, I haven't worked out in years, and I got to start continuing to do this.
Great.
Thank you. From the top up, I'm looking good. That's why.
I look good from the top down, Alan. So
But the thing about it is that it actually clears your mind, and it helps you think a little bit more when you work out and you're able to do this. I mean, what is working out, and how much should you work out? What do you think on from your perspective?
Well, here's what I can say. Going back to my, my training in psychology and psychoanalysis and all that, Viktor Frankl, that writer I told you about, the one who survived the Holocaust and wrote about how he wrote, people without a meaning in their life are exposed to aggression, depression, and addiction. And, there's no question that right now it is so important that with this downtime, we find a way to make it an uptime and to, rekindle activities that we once were excited about and that we enjoyed activities. And definitely spending that time with your son. And, I can't speak on behalf of how much you should exercise, even though I am quite chiseled myself. Thank you. Right, Mark? But there's no question that right now is definitely a time to embrace and to really find activities that you might have, not been engaging in for a long time because you got so caught up in the rat race. And especially with family and maybe even reinvent your role in the family, get to know your wife, your girlfriend, your children again in a different way. And by doing that, and by looking at ways also in terms of income, finding ways in which you can derive a different income stream, because there are some people that, like you're saying, construction may not be able to get out there, but find a different way getting healthy. I'll admit I have been doing some more, exercise with my kids, and it's fun. But by the same token, it's not. There is a certain kind of blocking out the fact that I am looking at my savings. There's no question. It's reality. You look at your savings, you kind of see where things are going, but you can't let that. And I'm saying what you can't do. You can't let that prevent you from living day to day and enjoying the time and the quality of life that you have right now.
Yeah, and there's only so much you have control over.
Yeah, exactly.
So,
Alan, may I ask Patrice a question? I'm just curious.
Yeah, sure.
You're doing all these calls about finances, and we're all talking about it, and I don't want to just act like everything's butterflies and rainbow, because that is a legitimate concern. So I'm not surprised at all that more people are concerned about what's in their bank account and putting food on their their family table than they are about catching the virus. So what do you say to people like that? Because Alan posted an article fairly recently on social media. I think it was, what was it? You're used to like 200 something calls or whatever a week, and now those calls are almost up to 600. So what do you say to people like that who are on the verge of a nervous breakdown going, that's great, great working out, great making a gratitude journal, I'm not going to put food on my kid's table, not going to get me a job right now. What do you say to them?
First of all, we want to let them know that we're in this together. Now, we have been fortunate at our center that we are kind of an essential service, but we have a lot of our staff that are working virtually. I'm working from home right now. But when a caller calls in, our staff are trained. We use Rogerian techniques. So we want to be supportive. We want to help them to do some creative problem solving, like some of the things we've been talking about, and also sharing the resources. But letting them know, I think when you know that other people are experiencing the same thing, you're not feeling so isolated and alone. And having 211 there as that supportive piece in the corner, we may not be able to solve that person's problems. But I think just letting, for example, when the landlords are starting to give out the letters encouraging people to pay or lose their apartments, we also have to remind that landlord that you can get that business loan. That person may not be able to get the job that needs to pay the rent. They may not be able to switch quickly from a hospitality. And who's hiring right now? That's the other thing, So it's, it's complicated. So it's just giving them that peace of mind, letting them know that we're here. We're trained to de-escalate crisis. If somebody is having a really severe mental health scenario, then we're working with our mobile crisis partners, etc. So it just depends on the scenario. But again, helping people to build, and here's the other thing too. We're first responders. A lot of you are first responders in a sense also. So taking care of ourselves. So I was one of the students that I had spoken to had been a nurse or was a nurse. And I think the story was that she had lost a patient or something too. But I mentioned that just like our staff, you have to sit in compassion. And at that moment in time, you're giving that person your undivided attention. You may not know the outcome of the scenario once they leave the call or what have you, but you know that you gave everything you could at that moment in time and step back. If you're a nurse or a first responder out there, you do everything you can at that moment in time to give that person that unconditional attention, and then you step back because you can't carry all of this. We cannot solve all these problems. We can help people to step towards something instead of stepping away from something, like we're having these conversations here. So there is a lot of brilliance and things to be seen through this. And of course, there's going to be change, but just helping people to grow through the trauma, grow through the change, and like you're all talking about, maybe becoming something different or seeing things in a different light, So I think that makes a difference. That was a long answer.
No, but it's a great point because again, I'm trying to make this, bringing hope, sound rosy. We know there's it's not all roses out there. I've heard a lot, I've seen a lot. My sister-in-law is a nurse in emergency room up in New York at Lawrence Hospital, where she was the one that took care of the first patient that came down with it in New York. And there's a lot going on up there. So I hear all the stuff, but they have hope. They know that eventually this is going to come down and it's going to end, or they're going to get control of it. All we want to do is let people know that the sun, as you said before, the sun will shine tomorrow. There are a lot of things that we can do right now. I had a post that I put on Facebook, and a high school friend of mine replied to it, and she's a teacher now. And I said, can you imagine if this was back in 1984 when I went to high school with you? We didn't have telephones. We had one telephone in the house. We didn't have cell phones. We had, so if somebody was on the phone, we couldn't get on it. Even then, you had to worry about how many times you were on the phone, how long you were on the phone for, because we had to pay per minute back then, especially long distance. You didn't have computers. You didn't have FaceTime. You didn't have Zoom. You didn't have all these things. All the kids now are learning online right now. They're going to school right now. They're going to be able to continue their year. So there's a lot to look forward to. I'm outside right now with you guys talking right now. It's beautiful out. So get the fresh air. There's a lot of positive things out there. So Any thoughts?
No, I thought that was good advice, Alan. I mean, another friend of mine suggested to another person to, we were talking about purpose, and Evan, I believe you brought that up. If you have purpose in life, but write a list. It sounds, I do this anyway, but maybe you don't. Somebody is watching. Write a to-do list every day. Like, make your bed. Whether it's say a prayer or go for a 20-minute walk, or maybe it's I'm going to learn one new thing every day. Take an online class. Like you said, 1984, couldn't do that. You couldn't do Zoom. Reach out to that friend you haven't reached out to in a while. So I'm so glad you brought that point out.
Or start a company online. You can do a lot of things these days. So,
right. There you go.
So we're going to wrap this up. But Evan, do you have any final thoughts for people?
Yeah, I mean, I think that the messages that have been shared here today are very powerful and meaningful. I think that we definitely have to be there for ourselves, kind of like in the airplane analogy, when they tell you when the oxygen comes down, if we have a decompression in the chamber, they always say, make sure you take oxygen first, because if you don't take the oxygen first and you pass out, who's going to put the mask on your child, right?
That's a great point.
I think that it's for us, for anyone else that's listening that might be a first responder as well, or just a mother or a father or somebody taking care of somebody, make sure you take some time for yourself and work on yourself, and keep doing those push-ups like Mark's doing every
other day.
Crunches, and Alan too. But I definitely think, and for me, I've already had multiple conversations with families that I'm working with, very similar to the loved one.
Sorry.
To the families of the loved ones that are in crisis. You got to keep it together. It's difficult. It's a challenging time, but let's stay focused. Let's come together with a common goal of helping your loved one. Take some time for yourself. But that would be the message that I would convey.
And what's the best way to reach you if someone needs your help?
Yeah, so the easiest way is just call me, and I have a direct number. It's 305-467-8666, 305-467-8666, or you can go to my website, which is careplanpro.com, and definitely reach out. We'll talk, and we'll see if we can help you out.
That's awesome. Mark, what's your message?
I guess my message is if someone in your family is in crisis, you got to reach out. The good news is, even though the courts are pretty much shut down, they are not shut down for the type of emergency court work that we're doing. So Marchman Acts, guardianships, those are the kinds of cases that a court is still hearing. And in fact, due to the fact that there's not so many cases getting filed in the court, I'm actually getting much faster responses on some of the emergency petitions that we file than we otherwise would. So if you need help, reach out. We're here. I'm taking calls 24/7. I filed the case late last night. So we're here to help. And we want to help.
Give us your contact info.
Sure. They can find us online, drugandalcoholattorneys.com. They can email me, Mark with a K, M-A-R-K, at drugandalcoholattorneys.com. Or they can call me, 561-419-6095. And that phone is answered 24 hours a day, 7 days a week.
That's awesome. Miranda, what's your message?
Well, first off, I have to thank Mark, Evan, and Patrice for helping all these people, because you are essential workers, and reaching out to first responders, because I'm sure that they are undergoing a lot of stress, more than they're even used to. So my message would be to try to look at this as an opportunity, and I realize that's easier said than done, but there are some things, little things that you could do that we mentioned: working out, writing in a gratitude journal. You would be amazed how the little step that you take can have a huge impact on your life. Absolutely. And also, hey, like we were talking about being creative. So I was supposed to do a storytelling event and read in front of a bunch of kids, not able to do that. But now you can find that story online at blossomsofloraland.com. So just be innovative with it if you can.
That's awesome. And Patrice, I left you for last because you're the one that gives us all the information.
Well, and the other thing is I have the easiest way to reach out. So they just have to dial the 211 number, or they can actually text to 898, text their zip code to 898-211. We also have online chat available from 10 in the morning till 8 at night. So we do have various resources that we're accumulating as we learn about them. But above and beyond all that, I want people to be gentle with themselves, feel what you're feeling. But if you're stuck, then reach out, and you're overwhelmed with feelings, reach out for professional help. But I also want you to remember the acts of kindness. Be kind. Check in on your elderly neighbor. Maybe drop off a few groceries for that person. Just check in to see that everybody is doing okay. We're in this together. We're here to support each other. And I think we're going to come out with a much better way of looking at things when we get through this trauma.
Yeah, and I really appreciate that message. That is right on point. And I just want to say that, again, we look at the positive outlooks on it. We got to live it day by day. Get together, know your family, make phone calls, FaceTime. You're not alone. So there's a lot of great things I believe that are going to come out of this. I think the finances are going to boom. I think everything's going to come back again. I know it will. So just hang in there. Reach out for help if you need it. And remember, you're not alone and you matter. So thank you very much. Have a great day and take care of yourself.
All right. Thank you so much, guys.
Thank you.
Thank you.
And that's a Real Convo, bringing hope and awareness to those affected by suicide and mental health. Tune in next Saturday at noon to the Real Convo.